Right, so this is part two, continuing on. So treatment prevalence, this prevalence of treatment, only 18% of the people in the U.S. with a mental disorder in the past 12 months receives treatment during the same time frame. 40%, less than 40% would receive what would be considered minimally adequate treatment, and only 15.3% of those with serious mental illnesses receive treatment that is considered minimally adequate. Um, so there is a lot to be gained from our treatment. A lot of people are not seeking it. So some of the barriers to treatment is that approximately 45% of those with a mental disorder report that they did not do so because they didn't think that they needed to be treated. Reason number two is individuals believe that they should be able to handle things themselves. This is the primary reason people with mental disorders give for not seeking treatment and for dropping out of treatment prematurely. People consider it not severe enough for treatment. About 17% consider the condition not severe enough for treatment. 16% felt the treatment would be ineffective, and then 9% felt that they didn't seek treatment because it was because of perceived stigma from others. The third main barrier is that they can't afford treatment, about 15%. There's no clinician available, about 13%. It's inconvenient to seek treatment, 10%, and trouble with transportation, 6%. So these barriers contribute to that very low percentage of people who actually get help when they need it. So treatment personnel, a psychologist is someone who practices psychotherapy with a specialization in clinical psychology, a PhD or a PsyD. A psychiatrist is a medical doctor who has completed an MD with a specialized training in assessing and treating mental disorders. Social workers have a master's degree in social work and have training in working with people in dire life situations such as poverty, homeless, or family conflict. Social workers tend to deal with a lot of severe cases, which they generally aren't as trained to deal with as a psychologist or psychiatrist, but due to financial reasons or otherwise, they are generally the first order of contact for severe or more severe cases of mental disorders. Counselors work in schools, generally have a master's degree with specific training in counseling in educational settings. So your school counselor, your school psychologist, if you've had one of those, anyone planning to be one of these, psychologists have a very difficult competitive field to get into grad school. Psychiatrists, you're competing with med school students, so it's a little harder. Social work is easier, and of course counselors. Both of these are master's program. They're easier, but generally more costly to get into. And the one that's not on here is a marriage and family therapist. They're only in some states, I think, and some programs approve of it, so it's a little of a niche. So types of treatments: psychological treatment in which people interact with the clinician to use the environment to change their brain and behavior, or biological treatment in which the brain is treated directly with drugs, surgery, or some other direct intervention. In some cases, both psycho and biological treatment are used. I should rephrase that and say that in the best case is that psycho and biological treatments are used. Percentage of people with a mental disorder who receive treatment, the greatest severity, so people who have greater severity tend to get treated, and people with greater income tend to get treated. So not all therapies are created equal. We will start by covering the types of therapies available. Think of one way to go about this is to think of a problem that you or a friend has. What type of therapy would you prefer? What type of therapy is intuitively more appealing to you? Psychiatrists are trained in the administration of medicine. That's why they're in medical school. Whereas psychologists provide psychological treatment, but not medicine. So that if you need biological treatment, the psychologist would have to refer you to a psychiatrist, which is a lot of runaround. But they have a new program now that psychologists can prescribe psychoactive drugs with, I think, a 2-year certification. But in general, this means that the coordination of treatment often requires cooperation between psychologists and psychiatrists. One stereotype is that if you see a psychiatrist, they're going to give you meds, whereas if you see a psychologist, they'll talk through the problem and more non-biological treatments. So that's the big difference between the two. So, a history of psych treatments. There's a movement from just ignoring and abusing mentally disabled people to asylums, housing them in a facility. But housing them in a facility did not guarantee improvements. But there is a current modern movement of deinstitutionalization and moving patients to be able to function in society, generally with the use of drugs and constant seeking sessions. And as we'll cover later, group sessions and the like. So psychopharmacology is the study of drug effects on psychological states and treatments. This is a scene from One Flew Over the Cuckoo's Nest. You can see the barred window, the idea of pretty much a prison for mental patients. Moving to a more open setting, nicer looking, a horror movie about the horrors of insanity asylums is session 9. So early treatments generally did not work. Hydrotherapy, holding someone down, wet pack, wrapping them in the wet, continuous bath, hot box, hot lamp, insulin therapy, and the infamous lobotomy, removal of brain parts. So this is a documentary called The Lobotomist. It's about an hour long. Watch it if you want. It's about how lobotomy came to be touted as the way to deal with the psych patients, which was totally wrong. So moving on to psychotherapy. So psychotherapy not involving biological treatment. So psychotherapy is an interaction between a socially sanctioned clinician and someone suffering from a psychological problem, with the goal of providing support or relief from the problem. 500 different forms exist, so there's a lot of variation. Over a third reported using electric psychotherapy, not electric, electric, a form of psychotherapy that involves drawing on techniques from different forms of therapy depending on the client and the problem. So here's the breakdown. Electric is a choice. That's just using all the tools that we have as psychologists. So cognitive therapy, behavior therapy. Cognitive behavior therapy is one branch. Psychodynamic is your traditional branch of psychology, and humanistic is your, I guess, your self-help and goodness psychology. So the first will cover your traditional psychodynamic and psychoanalysis. The idea is to explore childhood events and encourage individuals to use this understanding to develop insight into their own psychological problems. Psychoanalysis, as credited to Freud, assumes that people are born with aggressive and sexual urges that are repressed during childhood development due to use of defense mechanisms, as we covered earlier. Traditional psychoanalysis involves 4 or 5 sessions per week over an average of 3 to 6 years. That is really intensive. During a session, the client reclines on a couch facing away from the analyst and is asked to express whatever thoughts and feelings come to mind. One way to do this is free association, so just thinking of words that link to each other. psychologist probably says, just tell me what you feel, what comes to mind. Um, so they just start saying words, and the psychologist analyzes these word linkages for meaning. Another way is dream analysis, just a dream you had, interpreting what the symbols in your dreams mean and what they mean to you and your current condition. So this is the interpretation part. Therapist suggests possible meanings to the client for confirmation. So there's issues with this, which we'll cover later. Resistance is the reluctance to cooperate with treatment for fear of confronting unpleasant, unconscious material. So some of the things the psychologist suggests might trigger defense mechanisms in the patient, and so this will lead to resistance. Transference occurs with analysis when the analysis begins to assume a major significance in the client's life, and the client reacts to the analysis based on unconscious childhood fantasies. Um, Transference is an issue that's always present in a lot of psychotherapy, um, being that you tend to be the person that the patient relies on. And there's a lot of issues with when the power in psychotherapy. The therapist has to always understand that they hold a lot of power over their patients, and they have a lot of influence. Basically, you follow the therapist's suggestions and kind of unquestioningly in a lot of cases. So this leads to a lot of ethics issues. There's a huge ethical component to psychotherapy training, because of those power issues, and you can get in trouble for bad behavior with your clients. So moving beyond Freud's psychoanalysis to interpersonal psychotherapy, that focuses on helping clients improve their current relationships. So the idea is that if you have enough social support from the other relationships in your life, you would generally improve. So treatment focuses on interpersonal functioning, improving interpersonal relationships. The treatment is face-to-face. So instead of sitting on the couch, you face the patient. Therapy is less intensive, with meetings occurring only once a week, and therapy lasting months rather than years. So in contrast, humanistic and existential therapy, two well-known types of this is person-centered therapy and Gestalt therapy. So the first one, person-centered therapy, assumes that all individuals have a tendency towards growth, and this can be facilitated by acceptance and genuine reactions from the therapist. Therapy paraphrases the client's words, mirroring the client's thoughts and sentiments, e.g., I hear you saying. So if someone tells you a story and how they feel, you pretty much rephrase that and say to them, so I hear you saying that this person did that, and you are upset because da da da. So person-centered therapists believe that with adequate support, the client would recognize the right things to do. So finally, the therapist must treat the client with unconditional positive regard by providing a non-judgmental, warm, and accepting environment in which the client feels safe expressing his or her thoughts and feelings. So with this person-centered therapy, it's generally can deal with more milder cases, just being optimistic. You almost act like a friend to the person, a positive friend, and your therapy focuses on the person being able to be aware of what to do, how to correct the situation. So a very positive view of psychological disorders. Gestalt therapy helps the clients become aware of his or her thoughts, behaviors, experiences, and feelings, and to own or take responsibility for them. This might shift the attention to the client's current experience by asking, how do you feel? As you describe what happened to you, this technique is known as focusing. Gestalt therapy put the feelings into action. One way to do this is the empty chair technique, alternating role-playing, imagining what he or she would say to the other person and how he or she imagines the other person would respond. So Gestalt therapy is kind of very stripped down in a sense. It um, it lacks judgment. So you don't really make judgment. You just focus on what you're feeling, what's currently going on, um, and to lead to a result. So action oriented, very bare bones as the existential way is. Okay. So stigmatization with mental disorders. The stigma associated with mental disorders explain why most people with diagnosable psychic disorders do not seek treatment. So 60% do not seek treatment based on the idea that there's great stigma towards it, like the idea we mentioned earlier. The idea that we should be able to handle things ourselves, and seeking help is a sign of weakness. So that's a bad stigma. Another issue is that it's hard to really diagnose people correctly. So this was a study based on people faking a disorder. Faking a disorder such as schizophrenia. It's kind of easy. You go in there and you say you're hearing or seeing voices and acting like you're crazy, and you are admitted to the asylum. It takes a longer time to get released from the asylum, and generally released with diagnosis of schizophrenia in remission. So it's hard to correct a misdiagnosis. And psych disorders are easily faked. So another study, patients in the mental institutions were able to recognize the normality of the faked patients. So basically, when the patients were admitted, they started acting normal, and the other patients realized that they are actually normal and not crazy like the rest of them. So the staff took a longer time to recognize that fact. Another statistic is nearly 1 in every 10 students is getting mental health counseling on campus. So this is just arguing that we really need to get rid of the stigma against seeking mental help, because it's common. So taking a quick break.